The Cancer Prevention and Research Institute of Texas, or as we call it, CPRIT, is unique. It is a program that was voted on by the people of Texas, and it strives to tackle cancer, all different kinds of cancer, on multiple fronts. Today, we are delighted to have Carlton Allen, who is the program manager for prevention at CPRIT, talk to us about all the different things that CPRIT is doing. He shares his journey from being a public health person totally involved in public health and population health to a leading role that he has now with CPRIT. We'll also discuss how Texas supports groundbreaking research and prevention strategies that will impact communities across our great state. When you subscribe to our show, you help us grow. Someone you know may need to hear this story, so please share with your family and friends and consider supporting our mission at therose.org. Let's talk about your breast. A different kind of podcast presented to you by The Rose, a breast center of excellence and a Texas treasure. You're going to hear frank discussions about tough topics, and you're going to learn why knowing about your breast could save your life. Carlton, it's so great to have you here with us today. Thank you for making the journey all the way to Houston from Tyler. My goodness.
Of course. Thank you for having me. This is a wonderful opportunity.
So tell me, I'm really interested in how you got into public health.
I think like most individuals my generation, I was very interested in direct patient care. And during my undergrad and really during my grad school, that's kind of where I dabbled into public health and global health and really fell in love with, the population health aspect and not just treating one patient, but treating a whole community or working with the whole community.
So is that the big difference that you're looking at it on a much broader
I think
scale?
so. Public health seems to focus more on what we're doing as a whole as a public. So, yeah.
And where did you? Because I saw when I was looking at your resume and all, I thought, my goodness, you've been in this almost all your life.
A little bit, yeah. So I went to undergrad in Michigan. That's where I was born and raised, and so my undergrad is from Grand Valley State University, which is in West Michigan. And then I went to grad school at the University of Texas at Tyler, which is in Tyler, Texas, so East Texas for those Texans. And then right after grad school, I had an opportunity to work at our local hospital, our Academic Health Science Center. And I've been working there, I worked there for 10 years. Started off working with community health workers and patient navigators and trying to integrate them into our clinical operations, and really teaching our staff how to best use them. And then I had an opportunity to manage a colorectal cancer screening grant that we had, and then kind of the rest is history of how I've been in this cancer field.
So were you able to really bring in the CHWs and really get them within the whole framework of the hospital or the center?
We were. It was a learning process for everyone. At the time, this was 10 plus years ago, people really didn't know what a community health worker was and how to use it or how to use one. And so we had to train the staff about, how community health workers operate, what they could do. We had to make sure that all of our community health workers were properly trained. But by the end of the project, a lot of the clinics that we had ingrained the community health workers in, they were asking us either for more or when their community health worker wasn't there, the clinic wasn't operating correctly, right? Mm-hmm. So they became an integral part of our operations, yeah.
They are so important, but we still don't have funding for them.
No, unfortunately not.
What is it going to take? Really? Social services started the same way. Social service workers, same way. They were volunteers or then they were hired at a very basic type job.
Yeah.
But never were they reimbursed through the programs forever. I just can't imagine And this is national. This isn't just Texas. It's national.
It is a problem that other states aside from Texas are having of how to have these highly effective, highly trained workers that really impact a patient's care and ensuring that they are navigated through the system, how to actually get reimbursed for the work that they're doing, because it's not always direct, and it's not always like direct clinical. They're out in the field. They're doing other things to make sure the patient shows up on time and making sure that they have all that they need for their appointments and things like that.
Oh, yeah. And no-shows and compliance are two of the biggest issues we all deal with.
Exactly.
It doesn't matter.
Exactly.
It just still doesn't make sense. We have patient navigators. That's what we call our community health workers. But, I mean, they're street savvy. They have the language to speak with whom they're caring for.
Yeah.
And it's not just having a bilingual or any of that kind of stuff. It's knowing the words to use.
Yeah.
And being able to meet them at their own level. It doesn't make sense.
No, it really doesn't.
Mm-mm. So talk to us about the Cancer Prevention Research Institute of Texas, which we call CPRIT, and some call, don't they say it another way? I've heard other people say it.
More than not, I've heard CPRIT, but some people say CPRIT.
CPRIT,
Yeah.
right. So when I used it first, when I started talking about it, I'd say, the CPRIT grant. People go, you've got a secret grant? I go, no, the CPRIT. And then, my Texas accent sometimes can mess up these words, but boy, so, but tell us what it is, because now you have a very important role with them.
Yeah, so CPRIT is a state organization. It's the Cancer Prevention and Research Institute of Texas, and it is a government organization that provides cancer funding for organizations across Texas. CPRIT has sort of three main arms. We have a prevention arm, and that's the arm that I'm a part of, an academic research arm, and a product development arm. And so currently my role is the program manager for prevention.
Mm-hmm. That's a big role because that's all prevention, right? I mean, it's breast, colorectal, lung, tobacco,
cervical, So you have the primary preventions, the secondary preventions, which are your typical screenings that you mentioned, and then even tertiary, which is like survivorship.
Right. That wasn't always part of the CPRIT plan, I don't think, and it just morphed into it.
Yeah, as I think priorities changed and shifted, and we learned really how, what was burning in Texas the most. That's I think CPRIT has shifted with that.
Right. And this was something that the taxpayers voted for. Mm-hmm. So it is, and correct me if I'm wrong, this is unique to Texas.
It is unique to Texas. We are the only state that has something like this, yes.
And it covers all kinds of preventions, testing, takes us all the way through the diagnostics up until that treatment arm.
That is correct, yes.
And have they been exploring some treatment options for any of these?
As part of our prevention grants, just like you mentioned, we fund diagnostics and navigation into treatment. All of our grantees are required to have a plan for how, if there is an abnormal test, how they're going to get a patient into treatment, because we screening is no good if you can't treat them if something bad happens. So
and that's why this is prevention. This is why it's called that.
Exactly.
Yes.
Exactly.
And I know for the Rose, our patients, we have to be part of a plan. We always have to provide that. We were, and you probably know this, but when CPRIT first became real and issued their first grants in 2010, we were one of those. And, we were so excited. I mean, we had never had a grant that big, Our multi-year gave us such flexibility to really reach out. Carlton, we would still be in our little 7 counties, and we're now in 45.
I know. It's amazing.
Yeah, but we couldn't have done it without CPRIT. And the belief they had in our mobile program, which is how we go out and serve those areas.
Yes.
So do the taxpayers have to reapprove this every year or every other year? Or?
So not every year. Just like you mentioned, CPRIT was voted on in 2007, and it was voted on again or reaffirmed in 2019. So about every 10 years, the taxpayers have to vote on making sure that we have enough allocated funds. And
so far, the taxpayers have been very positive about the program.
Very positive.
I think they can see it.
Yeah.
Yeah. And I know you're not in the research, but, it's amazing to me that the funds that they've allocated to research have brought in some of the top-notch, most incredible researchers and have really made a difference.
That is definitely one of the shining spots of our whole organization, but in particular our academic research program is we have recruitment grants, and so with those recruitment grants, organizations across Texas are allowed to recruit individuals from all across the nation, all across the world to do their research here in Texas, and that's been phenomenal.
Oh, it has. It has really brought in some of the very best, and that alone makes such a difference.
Yes, agreed.
So, in your day-to-day work, what is most frustrating?
Probably that there is just one of me. Texas is a large state, and so I would love the opportunity to be everywhere. I would love the opportunity to visit all of our grantees. And on the prevention side, we have anywhere from 75 to 80 active prevention grantees across the state. And so they're doing phenomenal work all across the state. And, I sometimes get the chance to travel to see what they're doing and to meet with their staff and to see the communities that they're working in. But it takes a lot, and I don't get to be everywhere. So.
No, you can't. And we're talking about programs in El Paso or in the Rio area or anywhere.
Yep, from Brownsville, Texas, all the way up to the Panhandle, and as west as El Paso and as east as Tyler. So,
do you have a favorite?
Do I have a favorite?
We could eliminate this if that's. I know. There's 80 of them, and
I do not have a favorite, but I will say before coming over to CPRIT, I was a previous grantee, and so the grants that are in Tyler that I, had an opportunity to work with directly, always kind of hit home with me and impact the community that I live. So I always like to, make sure that those shine and see the good work that they're doing.
Oh yeah.
Yeah.
So in those communities, was it breast and cervical and?
We had a colorectal cancer grant for a long time, almost 8 years, and then they have a breast cancer screening grant that started a couple years ago. So,
I think the most significant statistic that we have found with our CPRIT grant is how many people have their first mammogram, and screening is hard enough, but convincing people to go ahead and have that mammogram is a big deal. And that's something that CPRIT really encourages, that we have outreach for that.
Yes.
It's almost a third of all our patients.
Yeah, that is definitely something that we make sure that our grantees are tracking and looking out for is those individuals that have never had a screening before and are screening age eligible. And just like you mentioned, it is unfortunately quite a bit that through one of our CPRIT grantees, this is their first time getting screened.
And we're talking low income and uninsured people, so
that's right.
It's not like they'd have another opportunity for this
exactly.
at all. So besides the Tyler one, what do you think has been the most, or what area has CPRIT been the most impactful? And we can stay in prevention. I mean, we know they have many achievements.
Yes, achievements across the board. As far as the prevention side, I really admire the work that we've done in the colorectal cancer space. We have grantees all across Texas that cover most of the counties, and recently, just a couple of years ago, we funded a colorectal cancer coordinating center, which covers all of Texas, but it was a way to kind of get all of our colorectal grantees together and figure out, what they're doing well and how they can share resources and how they can collaborate and what else could they be doing to address colon cancer across the state. I think, we've done a lot with colon cancer. We've also done a tremendous job with HPV vaccinations, and we have a number of grantees that are doing phenomenal work.
CPRIT was one of the first to really push that and be behind it.
Yeah.
Yes.
Yes. Yeah. And we actually just funded last year an HPV self-collection in clinic for vaccinations, which was really, it had just been FDA approved, so it was kind of first of its kind, and they're doing great work in a federally qualified health center, and it was amazing. Wow. Yeah.
Wow. Well, what this reminds me of is nobody really ever wants to talk about colon cancer. So CPRIT had to really put some resources behind just the education process of that. And that is one of the top killers if you get down to it, right? And it's so easy to find.
Yeah, exactly. Colon cancer, happens to be one of the most preventable cancers because you can, with a colonoscopy, you can essentially remove that cancer before it develops by taking out polyps. Mm-hmm. With colon cancer, we had to educate the population about what it is, when to get screened, the different screening tests before we even, said, hey, come in for a colonoscopy or hey, do a stool test. So it was a lot of education, especially in those rural areas that
that's just not something you talk about.
No, not at all.
Right. Well, and really, it kind of reminds me of what we went through in the breast world because there were so many myths and so many, untrue stories, and everyone had this idea that it was, something it wasn't. So I think we forget how important that education, that outreach is.
Definitely.
Yeah, and particularly with the male societies, the men who don't want to go anywhere anyway. Was there any program that was really used something very unique to make that happen?
Males, they continue to be one of those harder to reach populations. And I was talking with some colleagues just the other day about males that had developed cancer, whether it was colon cancer or prostate cancer, and them not feeling comfortable sharing that with friends or family, which has a direct impact with family because some cancers have genetic dispositions to them, and so if you're not sharing that with your family, you don't have an accurate family history, and you wouldn't know if you needed to be screened early or more often, and it has a whole effect on the family, and it's unfortunate that they didn't feel comfortable or feel in the right mindset to share that diagnosis.
That is something. Do you think we'll ever crack that nut?
I think so. I think men are becoming more and more comfortable, and there's men's groups and programs and organizations that sort of help bring that out where they feel a little bit more safe.
But we need the patient talking. Right.
100%.
Yeah.
The patient.
We did all kind of stuff on male breast cancer, but until I had a male breast cancer patient survivor, nobody paid attention. And then, it to me, that's just extraordinary.
Yeah.
How it changes when you're hearing someone's story.
Yeah, that patient perspective is uncanny. I mean, it is something that every program should somehow have an aspect of to help adapt their program.
Oh yeah. So tell us about the cancer plan, the Texas Cancer Plan.
Yes.
I mean, this is a big deal. And you spearheaded it.
I did.
And you looked very stressed there for a while as you were creating it.
I was. The Texas Cancer Plan, it is sort of like a roadmap for the whole state about what we should focus on, where we have the greatest burden, what our disparities are, our health disparities in regards to cancer. And it was something that I had the opportunity to take on. CPRIT is tasked with helping develop that and helping to implement that across the state. And so, cancer is huge. It is so much. And as I was working on this Texas Cancer Plan, which this was the 2024 one, and there's been previous additions. CPRIT has been involved with the Texas Cancer Plan since 2012. So they created the 2012 one and the 2018 one. Okay. But yeah, this latest one is the 2024 Texas Cancer Plan, and it involved a lot of, especially in the planning process, meeting with community members, stakeholders across the state to really try to figure out where we should focus, what our goals should be, what our objectives should be, how it needed to change, what needed to be updated. It was a lot of work, yeah.
Well, but you can see it in the plan. You can see that you actually had that input from the communities. But the other thing about it was, and of course, you would do this, was to make it web-based.
Yes.
Make it accessible.
Yes.
That thing used to be some kind of tome you were supposed to walk through. You know what I'm saying. But it is easy, and it's readable. You can grasp it. It's not just a whole bunch of words.
That is exactly what we were aiming for. We wanted it to be accessible for everyone, and we wanted it to be at a level that health professionals that are in the cancer world and have been working in it for a number of years would understand it and can use it, but also those that were trying to see how their organizations or how their community can work towards these shared goals and objectives could also use it as well.
So it's kind of a roadmap.
Yeah.
Yeah. Mm-hmm. And it's a very good one. I think everybody should at least know we have a plan and that there is something in the background always working with all of your grantees, and that we have to align our goals with these bigger goals.
Yeah.
Yeah.
That's exactly right. CPRIT continues to adapt their RFAs or our requests for applications based off of the greatest disease burdens in cancer and where we have the greatest health disparities, and making sure we focus on those counties that are rural or that don't have enough medical health professionals to address this disease.
In the area that we cover, half of the rural counties do not have any kind of mammography center, or the women have to drive an hour and a half to get to, the city that has one. Nobody's going to do that.
No.
I mean, if we don't pay attention to those things, then we have to take it to them. We have to make it available, accessible, convenient even. Folks just don't take care of their health like they should have.
Unfortunately not.
So I want to talk about your mini executive assistants. This is like when you have a meeting with your group and we see these little people coming by. I have heard so much about them. you're doing a lot of your work at home, and you have children. How many children do you have?
I have 3 children. I have my son. His name is Luther. He is 8 years old. Then I have 2 daughters. Emerson is 6, and then Zara will be 3 later in the end of April.
And I think when I heard some of the grantees talk, they're just waiting, hoping one will walk by. It's kind of like the highlight of the meeting. I'm going, y'all, come on, he's trying to tell us something important here.
Yes, they love to pop in to see who I'm talking to or what I'm doing. I'd like to say that I'm training the next generation of health professionals. They get to see the work that I'm doing, and I get to tell them a little bit about it. Yeah.
I think that is great. So how did you meet your wife, Christy?
Yes, Christy. We met in high school, actually. We're high school sweethearts. We started dating in high school.
Oh, my gosh. My goodness.
Yes.
Well, and she did some work where you were working, right, or in the Tyler?
So she works at, the University of Texas at Tyler. She works in their psychology department. She's an instructor, and so she teaches a number of classes. Like she has a love and relationships class, and she teaches intro to psych and things like that.
Interesting. Does she bring that home anytime?
Of course, of course she does.
Don't tell me you get to be the test subject. Oh, okay.
Yes,
okay, well,
I get to hear a lot of the lectures before the students do. Sometimes she wants my feedback, and sometimes she doesn't.
She just wants you to hear it.
Yeah, exactly.
Yeah. That sounds pretty typical. So speaking of which, what do you? And I know you do a lot of volunteer work in the community. It was so impressive. And you've been very active in key roles with so many of the community programs. Which one do you like the best?
Oh, which one do I like the best?
I'm not trying to put you on the spot, but there has to be some, your passion for healthcare is very obvious, Carlton.
Thank you.
I mean, so I'm curious what generates that.
I find it very rewarding to be involved with my community, to be involved with where I live and where I work. When I was working at the hospital, that was one of the things that I tried to ingrain in the team that I had back then is I said, we're working in this community. We're doing a lot of great work helping screen people, but I encourage them to also be a part of that community and to find ways to volunteer outside of work and what they were doing. And I think they actually loved that. They had never really had that opportunity before, and it was something that they took full advantage of. And oftentimes we would volunteer as a whole team or part of our team would do something.
But not only do you serve that way, but you gain the trust of that community.
You gain the trust of the community. You get to learn the community and see the community. And I think that was what made us probably the most successful is we were able to gain the trust of the community and I mean we were a part of the community. People knew us. We at the time, part of our education strategy was we had a giant inflatable colon that people could walk through and see polyps and see what colon cancer looked like, and so people knew, those are the people with the blow up colon, and yeah.
But still, you used a very different way, very unique way of teaching.
We tried to be innovative, yes.
So, with your training this next generation, what values do you want to leave your children with?
I want them to, to be hardworking. I want them to see what that hard work looks like. I also want them to have a sense of who they are, and by that I mean where they live and the community that, is going to help raise them, they go to school in East Texas. They play in East Texas. I have friends and family that help raise them and are surrounded, that they're surrounded by. So I really hope that they feel, comfortable and really a sense of family in our area.
Boy, so many children really don't know that.
I know.
And that is so important. Let them be themselves and be a child for a while.
Exactly.
Yes.
Exactly.
Protected and cared for.
Yeah.
Well, anything you want to tell our listeners? CPRIT, Cancer Plan, Carlton.
Yeah, just like you mentioned, I think everyone should know that there is a Texas Cancer Plan, and it's available. You can find it on our website, but it's texascancerplan.org. And I love the opportunities to talk about it, to see what programs are doing to help address our goals and objectives and help us, actually make meaningful change. And, I'll continue this Texas Cancer Plan Roadshow that I'm doing now that it's done. And yeah, love to talk about it.
Well, we're so glad you came today to talk to us about it. This is
you.
Great. Thank you so much.
Of course.
Thank you for joining us today on Let's Talk About Your Breasts. This podcast is produced by Speak Podcasting and brought to you by The Rose. Visit therose.org to learn more about our organization. Subscribe to our podcast, share episodes with friends, and join the conversation on social media using hashtag Let's Talk About Your Breasts. We welcome your feedback and suggestions. Consider supporting The Rose. Your gift can make the difference to a person in need. And remember, self-care is not selfish. It's essential.